Have you ever wondered why a patient with lymphoma involving their lungs and coughing up blood might only need standard precautions? Let's walk through that. Before that, if you are new to the channel, like and subscribe for more information. It's a great question. While blood can transmit infections, in this specific scenario, the hemoptysis, that's coughing up blood, from lymphoma isn't typically caused by an airborne or droplet spread infection. Lymphoma isn't contagious, so unless there's another coexisting infection that does require specific transmission-based precautions, standard precautions are sufficient. This means hand hygiene, gloves, and sometimes a gown or eye protection if splashes are likely. Remember, standard precautions are always our first line of defense. Always apply standard precautions for all patients.